The objectives for positioning the patient for a medical thoracoscopy include, from the patient standpoint, to gain a level of comfort, to avoid injury of soft tissues, and to avoid falls. From the procedural standpoint, we will need a good exposure of working areas to prevent inadvertent movements of patients during the procedure and to have enough space to work. In regards to the equipment that we will be using here, it will include a surgical table with an armrest as shown with the arrows, different type of support like surgical foam for the head, arm, and body, as well as cushion pillows, as many as needed to maintain the support of the patient. For support of the body of the patient, we will be using a surgical positioning system, which is also in our case a sandbag. The first thing to do is to position the patient on a lateral decubitus depending on which side we will be working on. We will be using different types of foam and cushioning in pressure areas, mainly on the ankles and the knees. This will be to prevent pressure injury. We'll have to expose working areas in the back as well as in the front of the patient. The arm needs to be positioned and extended and resting, and we will need to be secured to avoid inadvertent movement of the procedure. Finally, we'll be using the sandbag. We will be holding it in positioning against the patient and also connecting after that to suctioning. This will make the sandbag stiff and will avoid patient's movement. As a result, the patient is secure and safe for the procedure.